Good afternoon, ladies and gentlemen. I'm going to share with you the telemedicine initiatives in Pakistan. My name is Nazir Ahmad Waid. I had two different corporations. One is technology organization, which is NextSource, and other is eHealth, which is totally dedicated to telemedicine. We are actually experiencing the third revolution of human history. The first revolution was the agricultural revolution when we came out of the Stone Age and we started formal living, we started farming, we started family setup, the communities, etc. The second revolution was the industrial revolution. Everything changed again. And now we are experiencing the third revolution of the human history, and everything is changing again. We all know that 20 years back, when we wanted to travel, we really had a tough time getting our reservations. Now we do from our bedrooms and our office tables. The banking has totally changed. Previously, we had an account in a branch and we can only draw or deposit money only in that branch. Today, we can get our money anywhere in the world. Similarly, the functioning of the watches and clocks has totally changed. The way we communicate has been revolutionized. A friend went to Dubai for a business trip and his wife sent an SMS. How is it going? And he replied, I'm enjoying here, and he forgot the last E. And when he came back home, his face has all the colors of the rainbow, courtesy his wife. Anyhow, that's the latter part of the... We first developed a project called Project Hope, where we created a hub at the teaching medical school, which is called Jinnah Postgraduate Medical School. And then the other initiative we took in 2007 was in partnership with Telenor, the Norwegian company, which has Uninor in India, which is a triage service where doctors are available on phone 7/24. We have created certain software and other solutions. We have got translation tools to address the illiteracy and the language barriers. Of course, we have electronic medical record. We initially bought this from India, got it developed from India, from Medisoft in Ahmedabad. Now we have created patient or personal health record, as we call it PHR, on USB. I'll tell you a little bit more on this. We have developed our own indigenous DSS. The prescriptions are sent on SMS and local languages. And we have developed voice messaging broadcasting system, which is used for health awareness. And we also conduct surveys and feedbacks through audio tools. We did some work in disaster health management using telemedicine. So after the earthquake we had in Pakistan, in partnership with Telenor, we served about 200,000 people, either through phone or doctors physically there for 1 day or 2 days a week, and rest of the day serving through telephone. We did the same thing on post-flood situation. We are operating regular e-clinics, which are actually telephonic clinics, in a place called Tata, even to date. As in every developing country, we have a similar situation that quality healthcare is only available in the urban areas. There's absolute vacuum in rural areas, and like many other countries, we have 65% population in rural areas, which constitutes about 117 million people. The cellular technology and all the modern technologies, the revolutionary technologies as I call it, has really facilitated eliminating the gap between the patient and the doctor. So we call it PPP, patient and physician are connected through the providers. Project Hope has been a public-private partnership. We came in as the technology providers. There is a large conglomerate called Anglo Group that provided the funding, and the government provided us the HR, the hospitals, the remote locations, which we call BHUs, basic health units in rural areas. We have seen over 40,000 patients during last 6 years. Consultants are at the teaching school, and patients are in 12 small rural towns. So they are connected through technology, either on store and forward method or through video conferencing. This is the picture, our CEO, Dr. Zakiuddin Ahmed. He is sitting with the DG Health at the hub in JPMC. The teledoctor had been developed in partnership with Telenor. In Pakistan, in rural areas, the people, when they get sick, they are at the mercy of the midwives, the quacks, or the spiritual healers. And when the case is totally spoiled, it rushes towards the metropolitan areas, and it's such a terrible travel that they take that the trauma further unstabilizes the patient, and in most of the cases, the patient cannot survive. I'm sure a similar situation exists in India. So what we do is we provide at least first-hand guidance to the patient as far as we can help on the telephone, and then we suggest him where to go exactly, and we try to set up an appointment for the patient. If is it possible, we also arrange the ambulance for the patient. So this is how this 1911 service, as it is very popularly known in Pakistan, is serving. We have taken care of over 5.5 million unique patients. Many of them are repeat callers. This is one of the advertisements which normally appears on the telephone, on the newspaper, print media. This is our call center where our doctors are stationed. After learning from these endeavors and initiatives, we have developed some serious future plans. We are building a hierarchical infrastructure with 3 national health units, 15 regional labs, 300 plus regional health units, and 15,000 rural health units. We have created standardized telemedicine tools. We have built an indigenous health service franchise. The local health unit is going to be something like a kiosk, but of course not what we see in the picture. It will be a little larger than that. And this is a place where a person in a village, if he needs medical help, he would travel to one of these facilities, 15,000 of them. And he will be, the local paramedic will take the history of the patient, create an EMR, and then he will be given access to a doctor at the regional health unit. Now this location can also collect lab samples, can do all the vitals, can even do minor procedures. This is the flow chart of the patient, how we're going to handle them. The tools we have developed indigenously are the EMR for our desktop and PDA applications with DSS. The EMR itself takes or connects with the DSS. So when the symptoms are put in, the DSS automatically starts working. But we're not going to put DSS to the mercy of the machine because it is still evolving, so the final decision will be human. The doctors will take the decision. Maybe over the next 2 or 3 years, we will be confident enough that yes, the DSS can be described as dependable. We have also developed data translator from any known modes of data to HL7 format. So, many hospitals, many locations in Pakistan are still using old EMRs or hospital management systems or HIS, and very often we send them to doctors abroad, so that will be converted into HL7 and then sent. We have developed a lot of mass communication tools to support our system, and we have also developed portable mHealth clinic, which I'll show the pictures later on. The challenges that came across during the 6-7 years of our endeavors: the computer or technology phobia in healthcare professionals and decision makers. We just heard from the other gentleman a while back. So we have developed very user-friendly touch screen, drop-down menus, and dashboard view leading to details. So when the doctor receives the EMR, it is in a form of dashboard, and it is also suggesting the diagnosis. And then he can go to each detail if he wants to, before he gives his own decision. We have developed language and literacy, phased language and literacy barriers, because Pakistan only has 49% people literate. Out of them, only 10% can speak English. And most of the data or the information that you would like to share with the patient is in English. So we have got machine translations developed in all our local languages. So any data or prescription or directions sent to patient, either on his phone or in a printed form, will be in his local language. And if he cannot read, if he is totally illiterate, then he can receive it in his voice. So he can receive a telephone call and he will hear it. If he wants to hear it again, then there is a bubble message on his SMS bank, and that he has to click and he will get the message again. So he can listen to the prescription or any other advice given by the doctor or information on his disease any number of times he wants. Of course, like many other countries, we have no legal code, so that's a challenge. The regulator is at loss how to deal with us, but they have shown confidence. My CEO, Dr. Zaki, he is a coordinator for e-health in the Ministry of Health, so we have a person in the presidency. The other major challenge is low affordability of our target patients, because the rural people are mostly with low earnings and they have their own challenges. This is a graphic view. In the center you see 3 NHUs, and then we have got 15 imaging and lab facilities, and then 300 plus regional health units, and then 15,000 rural units. This is our remote patient monitoring system. So this has got all the gadgetry to collect vitals. So all the data is collected on this, and then it can be transferred through internet, and it can reach our server. These are the other gadgets we normally use. These are all imported. We have also developed a lot of other indigenous peripherals, assessment peripherals in Pakistan. So the regional health units employs 2 full-time general practitioners. It has 3 inpatient beds, which are kind of semi-ICU. So if a patient is received there in unstable condition, we do not rush him to a tertiary care hospital. Instead, we hold him there, we put him under advice of a specialist, a relevant specialist, and then we wait till he is stable enough to travel to a tertiary care facility. So we have 3 such beds over there. It has basic imaging facility. Minor operations can be performed there, surgical procedures, and well, it will have accommodation for the medical staff and ambulance ready 24/7. This is just a floor plan. The regional labs will have a state-of-the-art imaging facility, which will include CAT scans, MRIs, doctors, etc. And it will have all the advanced pathological tests facilities available there. And all the reports will be electronically posted on the relevant EMRs. The national health units, which are 3 in number in 3 major cities, will have 60 specialists sitting in rotations. It will have 300 general physicians. So the overflow from the regional health units will be transferred to these locations, and of course, management personnel and technical staff. Each LHU will be developed to cater a population of 10,000 people, which is about 6 to 7 villages in the vicinity. Normally, a person can reach there in about 15 minutes by walk or on a bicycle or on any means of transport that is available in rural areas. And each RHU serves 50 LHUs, the rural units, and then 20 regional labs will, or each lab will take care of 20 regional hubs. So this is how the whole network has been designed. This is a snapshot of our EMR that we're using. If you look at the bottom, type your SMS message here. So this is where the doctors type their SMS message. and it is then translated into the language of choice. And then, so these are the ultimate beneficiaries of our project. Talking of India-Pakistan relationship, I think it's time to think region, not nations. We have had enough. Very recently, Pakistan has given the MFN status to India. And only yesterday in Maldives, Indian Prime Minister Mr. Manmohan Singh announced that Pakistan will be granted a preferred nation status. So there will be a lot of extraordinary facilities extended to Pakistan. So a lot could be done together between India and Pakistan to really take good care of the population in the SAARC countries, the South Asian nations. So what NextSource is doing is extending quality healthcare where it is needed most. We are really filling the vacuum. We're creating direct influence over 15 million people. That's our estimated number who will be taken care of as far as the healthcare is concerned, and they are most deprived people. Then we are creating high-value rural employment. The whole network over the next 7 years will employ 105,000 people. So this will be quality employment, they will be trained, they will be making good money, and that will ultimately result in rural economic development too. So basically we are changing the healthcare ecosystem of Pakistan and presenting a model to the world.